Incentive spirometry. Since I'm going to be the patient, some things I'm going to do before I go in the room is to check the patient's chart. I want to make sure that the therapy is coinciding with their pain medication schedule. Wash my hands, get my gloves, make sure I have all my equipment. When I do go in the room, I need to assess the patient, respiratory rate, heart rate, lung sounds, pulse ox. I noticed in the chart that the patient was pre-instructed on how to use the incentive spirometry device prior to their surgery. So they may need a refresher before they actually start using it after surgery. If they're in a lot of pain, pillow to splint while they're using the device. And you want to inhale slow and then hold for about 3 to 5 seconds. So I only got up to 2,000. So ideally I do this about 6 to 10 times an hour, making sure I have enough time in between uses to keep from hyperventilating. There's a little chart that comes in the package where I can keep track of my goals and how much I'm doing. Ideally you want to go in the best area here, and then you just set this based on your goals. So if I was at 2,000 now, maybe next time I want to go to 2,500 if I can. And then I'd make sure I reassess my patient afterwards, and I can label it on the bottom with the patient's name and date. And then just periodically check in with them, make sure that they're performing their therapy and doing it correctly. Make sure they have no questions.